Hello, my name is Maury Wiegand, and I'm a graduate student at the University of Montana, completing a master's degree in public health. I'd like to talk with you today about the challenge of burnout in the nursing profession, the implications of burnout that are specific to rural and frontier areas, and how resilience building interventions may help to alleviate some of the stressful challenges that are currently facing nurses. The increasingly surging nursing shortage in the U.S. has dramatically impacted the underlying problem of burnout for nurses. Even before COVID 19, more than 75% of nurses surveyed in 2005 reported increased stress levels, a perceived decrease in the quality of patient care, and a remarkable increase in the thoughts of leaving the nursing profession. More recent surveys estimate that burnout rates are well over 40% in most clinician groups and as high as over 80% for some of these health practitioners. The current demand for nurses, exacerbated by COVID-19 pandemic, has highlighted the need to ensure a robust and resilient workforce for nurses, and attention to this burnout has never been more consequential. The population and geographic location we work and live in is often defined by the size of the communities, each exhibiting unique cultural characteristics. Urban areas are defined as regions surrounding a city. Rural areas are generally termed as the country. Frontier areas are the most remote and sparsely populated places along the rural to urban continuum, with residents far from healthcare, schools, groceries, stores, and other necessities. Montana, the fourth largest state in the United States, ranks third as the least densely populated state with a population density of 7.42 persons per mile, outranked only by Alaska and Wyoming. One half of the counties in Montana have 3 or fewer persons per square mile, with 6 of those counties having less than 1 person per square mile. For a comparison, the state of New Jersey has a rural density of 1,210 individuals per square mile. Montana State University and the Mark and Robin Jones College of Nursing faculty were some of the first to recognize the disparities for nurses in rural and frontier areas. In 1975, MSU's Dean of College of Nursing, Dr. Anna Shannon, was convinced the nursing practices in rural environments differed from an urban setting. Over 4 decades have passed since this initial work on rural nursing theory, which continues today. This intersection of rural living and healthcare challenges can create barriers to care that providers may not be trained to navigate, resulting in higher burnout and turnover. Nurses in Montana face ongoing challenges in rural service delivery due to the unique remoteness of the state we live in. One significant challenge exists in the fact that many frontier counties do not have a hospital or critical access facility. Often, frontier counties lacking services are clustered together, compounding the distance residents must travel to receive care. Other barriers to accessing healthcare in frontier areas include limited or unavailable public transportation options for low-income households, the elderly, and people with disabilities. Seasonal travel barriers, something that we experience for much of the year in Montana, occur due to obstructions such as snow, ice, and flooding weather conditions. Traffic fatalities are also more common for frontier residents due to poor infrastructure, such as narrow roads with bidirectional traffic. In addition, the increased time to receive emergency care and reach a hospital which is capable of treating severe trauma in frontier area contributes to a higher fatality rate among our residents. Also, because of these barriers, rural dwellers are less likely to seek preventative care measures, which increases their chances of developing chronic diseases. Research is also showing that rural communities are at higher risk for substance abuse, suicide, obesity, cigarette smoking, and death from unintentional injuries such as motor vehicle accidents. Mental and behavioral health providers have recognized the problems of substance abuse and domestic violence as also being significantly more prevalent in frontier areas. The isolation that pervades over rural communities accelerates all these factors, and COVID-19 has sought to amplify the healthcare needs for rural and frontier populations. The term burnout was introduced by Freudenberger in 1974 when he observed a loss of motivation and reduced commitment among volunteers at a mental health clinic. the Maslow Burnout Inventory, the internationally widely used instrument to measure burnout, sought to design a scale that accesses various aspects of burnout syndrome. According to Maslach's conceptualizations, burnout is a response to excessive stress at work, characterized by feelings of being emotionally drained and lacking emotion, now commonly referred to as emotional exhaustion. Symptoms include a negative and detached response to other people and a loss of idealism, also known as depersonalization, with an associated decline in feelings of competence at work or personal accomplishments. In response to the increasing pressures facing nurses who find themselves within overstretched and under-resourced healthcare systems, building personal resilience has been identified as being essential to coping. Resilience has been conceptualized in many ways. However, a common definition is that resilience is the ability to cope successfully despite adverse circumstances. In a recent study of nurses, a key attribute to sustaining resilience included social support, self-efficacy, work-life balance, self-care practices, humor, optimism, and the quality of being realistic. Resilience has been viewed as both an inherent personality trait as well as a dynamic process, with these traits existing on a continuum. Much of the research has outlined that resilience in the nursing workforce is a fluid process that can ebb and flow depending upon the nurse's conceptual circumstances and the working environment. Interestingly, the very traits that make you a good nurse, dedication, responsibility, motivation, conscientiousness, and attention to detail, are also the traits that increase your vulnerability to burnout. Though the characteristics of stress indicators are unique in the frontier areas, burnout itself, what constitutes it, what factors contribute to its development, and the consequences it brings for nurses and their patients share many common elements with urban and rural locations. Nurses commonly experience incidences of workplace adversity that can impact their levels of resilience. An article published in 2020 looked at 91 different studies on burnout within the nursing profession and classified factors as either being external or internal. External factors include high workload, low staffing levels, long shifts, shift works with nights, weekends, and holidays being spent away from families, and low levels of control. All are being associated with higher levels of burnout. Internal factors leading to burnout include a specific set of character or personality traits. As I read through these factors, please think about which of these traits might most align with your own personality. Low hardiness, meaning limited involvement in daily events, a sense of no control over events, and unwillingness to change. Diminished external locus of control, or feeling as though chance or other people have more power to bring about change than yourself. Tendencies to be time pressured, competitive, hostile, and controlling by nature. Perfectionism. Unrealistic expectations about patients' outcomes. Passive coping styles, that is, you tend to withdraw when challenges arise versus investing the energy needed to confront them. A mentality of delayed gratification, that is, you have a sense of needing to put off your own needs until something else happens, as in, I'll take better self-care after I finish my nursing training. Various studies have shown that a mixture of these external and internal factors can affect burnout. For example, nurses who reported low external factors, noting they worked in a good work environment, had much lower burnout rates and higher job satisfactions. Clearly, burnout is a significant problem with far-reaching effects. Individual outcomes for nurses range from marital discord to personal health implications, including, but not limited to, suicidal ideation, substance misuse, depression, anxiety, fatigue, insomnia, and any number of ensuing chronic health diseases. Since the work environment demands are often outside the control of individual nurses, I would like to focus on the positive effects of creating and utilizing self-help interventions. Recent research consistently notes that creating self help intervention plans significantly increases resilience and reduces burnout, independent of the work conditions experienced. Relevant to your studies in nursing, a recently published paper sought to predict the chances of burnout among nursing students. It was noted that nursing students tend to have non traditional nursing profiles and that there's a high number of students from lower social economic backgrounds, first and family students, more mature age students, as well as more female students. This would suggest that nursing students are more likely to have external commitments that compete with their studies. Indeed, this was confirmed by a literature review identifying the major stressors for nursing students were time demands of family and financial concerns. How nursing students manage the competing demands of academic work and clinical placement may be an indicator of their resilience to manage the stressors associated with the employment as a nurse. Most students entering the nursing profession display characteristics compatible with the concepts of resilience, including altruism, vocational empathy, and caring for others. These qualities must be continuously reinforced and supported throughout both your studies and your nursing careers. What are possible ways to prevent burnout and increase resilience for both nursing students and career nurses? Again, recent studies focused on overcoming adversity emphasized that having and implementing a personal plan was key. According to the results of this study, when nurses felt that they were going through a difficult situation, the ability to recognize and acknowledge that situation through self-exploration and not evading the issues and engaging in self-help interventions resulted in higher levels of self-efficacy and higher overall resilience indicators. On a larger scale, with the recognition that the function of the U.S. health system is at stake, the National Academy of Medicine released the National Plan for Health Workforce Wellbeing in October of 2022 with the goal of a collective action to strengthen health workforce well-being and restore the health of the nation. The National Plan is a critical starting point for collective action in providing an organizational roadmap for improving nurses' working environment while proactively addressing the need for nurses to maintain and build their personal resilience. As you build a practice of self-care and mindfulness through the self-care assignments that you're working on this semester, you are creating a game plan that will become a solid foundation when confronting both personal and work environment resilient challenges. Hopefully, you'll be able to carry these insights you gain from these self-care exercises to fall back on and rally your resilience skills throughout your nursing career. The more you're able to cultivate resilience and decrease your risk of burnout, the better you'll be able to take care of yourself as well as your patients. Thank you so much for listening to my thoughts on nursing burnout. Thank you.